Are you taking spironolactone, or has your doctor prescribed it? This powerful, water pill plays a crucial role in managing various health conditions, from heart failure to high blood pressure. Understanding how it works, what to watch out for, and how to take it correctly is key to your well-being. Let's dive into everything you need to know about spironolactone. Spironolactone, known by brand names like aldactone and carospir, is a special type of medication called a potassium-sparing diuretic. Think of it as a water pill that helps your body get rid of excess salt and water. Unlike some other diuretics, it's designed to prevent your potassium levels from dropping too low, which is a significant benefit. This medication works by blocking a hormone called aldosterone, which is produced by your adrenal glands. Aldosterone helps regulate the balance of salt and water in your body. By blocking it, spironolactone helps reduce fluid retention and can improve conditions related to too much aldosterone. Spironolactone is a versatile medication used for several important health issues. It's commonly prescribed to treat heart failure, helping to reduce the strain on your heart and manage fluid buildup. If you have high blood pressure, also known as hypertension, spironolactone can be an effective part of your treatment plan. It also addresses hypokalemia, a condition where you have low potassium levels in your blood. Beyond these, spironolactone is used to treat fluid retention, or edema, which can occur with congestive heart failure, liver cirrhosis, or a kidney disorder called nephrotic syndrome. Your doctor might also use it to diagnose or treat conditions where your body produces too much aldosterone. Before you start spironolactone, it's crucial to discuss your full health history with your doctor. You should not use this medication if you are allergic to it, or if you have certain conditions. These include Addison's disease, which is an adrenal gland disorder, or if you have high levels of potassium in your blood, known as hyperkalemia. It's also not safe to take spironolactone if you are unable to urinate, or if you are already taking another medication called eplerenone. While animal studies showed tumors, it's not known if this applies to humans. Always use this medicine only for conditions your doctor has specifically checked and approved. To ensure spironolactone is safe for you, tell your doctor if you have any existing health conditions. This includes an electrolyte imbalance, such as low levels of calcium, magnesium, or sodium in your blood. Kidney disease, liver disease, or heart disease are also important to mention. If you are pregnant or planning to become pregnant, inform your doctor immediately. Having conditions like congestive heart failure or uncontrolled high blood pressure during pregnancy can lead to medical problems for both mother and baby. Your doctor will weigh the risks and benefits to decide if spironolactone is appropriate for you. It may also not be safe to breastfeed while using this medication, so always ask your doctor for guidance. Taking spironolactone exactly as prescribed by your doctor is essential for its effectiveness and your safety. Always follow all directions on your prescription label and read any medication guides or instruction sheets provided. Your doctor may adjust your dose occasionally based on your response and condition. Never share this medicine with another person, even if they have similar symptoms. You can take spironolactone with or without food, but try to take it the same way each time to maintain consistent levels in your body. You will need frequent medical tests while on this medication, so be sure to attend all your appointments. Spironolactone can affect the results of certain medical tests. Always tell any doctor or healthcare provider who treats you that you are using spironolactone. If you need surgery, inform your surgeon that you are currently taking this medicine, as you may need to stop for a short time before the procedure. If you are being treated for high blood pressure, it's vital to keep using this medication even if you feel well. High blood pressure often has no symptoms, and you may need to use blood pressure medication for the rest of your life to manage it effectively. Store your medication at room temperature, away from heat, light, and moisture, to maintain its potency. Your doctor will determine the specific dose of spironolactone that is right for you, as it varies greatly depending on the condition being treated. For conditions like edema, which is fluid retention, the dose might range from 25 to 200 mg per day. For high blood pressure, an initial dose might be 50 to 100 mg daily, with adjustments made over time. In cases of congestive heart failure, the initial dose is often 25 mg once a day, carefully monitored based on your potassium and creatinine levels. For primary hyperaldosteronism, doses can be higher, used for diagnostic tests or long-term management. If you have low potassium, hypokalemia, doses typically range from 25 to 100 mg daily. Always remember, these are general ranges. Your doctor will tailor your dose precisely to your needs. If you miss a dose of spironolactone, take it as soon as you remember. However, if it's almost time for your next scheduled dose, skip the missed dose entirely. Do not take 2 doses at one time to make up for a missed one, as this can be dangerous. In the event of an overdose, seek emergency medical attention immediately. Certain substances and activities should be avoided or approached with caution while you are taking spironolactone. Drinking alcohol can increase some of the side effects of this medication, so it's best to limit or avoid it. Do not use potassium supplements or salt substitutes unless your doctor has specifically told you to. These can significantly increase your potassium levels, which can be dangerous with spironolactone. Avoid a diet high in salt, as too much salt will cause your body to retain water and can make this medication less effective. Be cautious when driving or engaging in hazardous activities until you know how spironolactone affects you. Your reactions could be impaired, especially if you experience dizziness. Also, avoid getting up too fast from a sitting or lying position, as this can cause dizziness or lightheadedness. Like all medications, spironolactone can cause side effects. Some require immediate medical attention. Get emergency medical help if you have signs of an allergic reaction, such as hives, difficulty breathing, or swelling of your face, lips, tongue, or throat. Call your doctor at once if you experience a lightheaded feeling, like you might pass out, or if you have little or no urination. Watch for signs of a high potassium level, which include nausea, weakness, a tingly feeling, chest pain, irregular heartbeats, or loss of movement. Also, be aware of signs of other electrolyte imbalances, such as increased thirst or urination, confusion, vomiting, muscle pain, slurred speech, severe weakness, numbness, loss of coordination, or feeling unsteady. A common side effect can be breast swelling or tenderness. This is not a complete list, so always report any unusual symptoms to your doctor. Spironolactone can interact with other medications, potentially changing how they work or increasing side effects. Using spironolactone with other drugs that make you dizzy can worsen this effect. Always ask your doctor before using opioid medication, a sleeping pill, a muscle relaxer, or medicine for anxiety, depression, or seizures. It's crucial to tell your doctor about all your other medicines, including prescription and over-the-counter drugs, vitamins, and herbal products. Specific medications to mention include colchicine, digoxin, lithium, loperamide, and trimethoprim. Also, discuss any other heart or blood pressure medicines you take, especially other diuretics, medicines to prevent blood clots, and NSAIDs, non-steroidal anti-inflammatory drugs, like aspirin, ibuprofen, or naproxen. This list is not exhaustive, so a complete medication list is vital for your safety. Remember, this information is for educational purposes and should not replace professional medical advice. Always keep spironolactone and all other medicines out of the reach of children. Never share your medicines with others, and use spironolactone only for the indication prescribed by your doctor. Understanding your medications is a powerful step towards better health. If you have any questions or concerns about spironolactone, don't hesitate to speak with your doctor or pharmacist. They are your best resource for personalized medical advice. Stay informed, stay safe, and always consult your healthcare provider to ensure the information applies to your personal circumstances.